pause it really quick. Hello, everyone. In this segment of the American Indian Cancer Foundation's Train the Trainer series, we'll discuss education, screening, and prevention, breast cancer in Indian country. The segment of today's training will be broken up into 3 separate sections. Part 1 will cover Breast Cancer 101, which includes reviewing the anatomy of the breast, going over what exactly is breast cancer, the common types of breast cancer, as well as breast cancer data and facts. The second portion of this segment will look at prevention, risk factors, and signs and symptoms of breast cancer. The third and final portion of this segment will cover screening options, screening guidelines, and finish with staging, treatment, and associated survival rates. So let's start off with breast cancer basics, or breast cancer 101. Be sure to pay close attention throughout the presentation, as there will be some questions for you to answer to check your knowledge. Here's a brief overview of the anatomy of the breast, the basics that you'll need to know to understand the different cancers that we'll be talking about later on in the presentation. As an FYI, this anatomy will focus on a woman's breast anatomy, as more than 99% of breast cancers occur in women. As we know, breast cancer can occur in men, but it occurs in less than 1%. It is still important to recognize that men are able to get breast cancer and recognize that some of the symptoms and risk factors may be the same. According to the Mayo Clinic, the structure of the female breast is complex. The breast anatomy includes fat, glandular and connective tissue, as well as lobes, lobules, ducts, lymph nodes, lymph ducts, blood vessels, and ligaments. The breast does not, however, contain any muscle. The muscles lie beneath the breast, separating them from the ribs. Moving into more detail of the breast anatomy, we have the lobules and ducts and their components. Again, the Mayo Clinic and Susan G. Komen specify that each breast is made up of sections called lobes. Each breast is comprised of about 15 to 20 lobes. Each lobe is made up of a smaller section called lobules, and there are around 20 to 4 lobules per lobe. Each lobule holds tiny hollow sacs, which are called alveoli. Lobules are connected or linked by a network of thin tubes, which are called ducts. There are about 10 duct systems in each breast. If a woman is breastfeeding, the ducts carry milk from the alveoli to the areola, which is the dark area of the skin in the center of the breast. From the areola, each duct system then joins together and opens at the nipple. The Mayo Clinic explains that the spaces around the lobules and ducts are filled with fat, ligaments, and connective tissue. It is the amount of fat in the breast that largely determine the size, but the actual milk-producing structures are nearly the same in all women. Female breast tissue is sensitive to the cyclic changes in hormone levels. Most women's breast tissue will change as they age, with more fat relative to the amount of breast tissue. Interesting enough, breasts don't have any muscle tissue. The muscles lie underneath the breasts, which separate them from the ribs. Additionally, oxygen and nutrients travel to and through the breast tissue through the blood and arteries in the capillaries, which are thin, fragile blood vessels. The lymphatic system is comprised of lymph nodes and lymph ducts and is part of the immune system. This system helps fight infection in the body. The lymph nodes are found under the armpit, above the collarbone, behind the breastbone, and in other parts of the body. The lymph nodes and lymph ducts trap harmful substances that might be in the lymphatic system and safely drain them from the body. So what is breast cancer exactly? Breast cancer is cancer that forms in the tissues of the breast, most often the ducts and lobules. There are multiple different types of breast cancers. Ductal breast cancer and lobular breast cancer are 2, and we'll talk about these in the next 2 slides. A couple more uncommon types I want to briefly mention are inflammatory breast cancer and mucinous breast cancer. Inflammatory breast cancer accounts for about 1 to 3 of all breast cancers. Inflammatory breast cancer typically presents with no tumor or lump. This type of cancer may make the skin on the breast feel warm, itchy, or look red. This type of cancer is caused by cancer cells blocking the lymph vessels in the skin and then therefore has a higher chance of spreading to other areas in the body. This type of cancer may be harder to find because it is often mistaken as an infection. It usually isn't found by a mammogram, but rather by a biopsy, which is a procedure to remove tissue, including cancerous and precancerous cells. Mucinous breast cancer is a rare form of invasive ductal carcinoma. This tumor is made up of abnormal cells that are in the mucin, which is responsible for making mucus. The mucin lines most of the inner parts of our bodies, and in mucinous breast cancer, it surrounds the breast cancer cells and becomes part of the tumor. This type of breast cancer usually affects women who have already gone through menopause. The common types of breast cancer. Ductal carcinoma in situ, or DCIS, is the most common type of non-invasive breast cancer. Ductal means inside of the milk ducts, and in situ means in its original place. DCIS isn't life-threatening, but having DCIS can increase the risk of developing an invasive breast cancer later on. Usually people who have DCIS are at a 30% higher risk for the cancer to come back or developing a new breast cancer. These usually occur 5 to 10 years after the first diagnosis. According to the American Cancer Society, about 60,000 cases of DCIS are diagnosed in the United States each year, accounting for about 1 out of every 5 new breast cancer cases. Invasive ductal carcinoma. Invasive ductal carcinoma is the most common type of breast cancer. This type of cancer starts in the milk duct of a breast and is able to spread through the lymphatic system and bloodstream. About 8 out of every 10 breast cancers are invasive ductal carcinomas. Invasive lobular carcinomas begin in the milk-producing glands or lobules of the breast. Invasive cancer means the cancer cells have broken outside of the lobule where they began and have the potential to spread to the lymph nodes and other areas of the body. About 1 in 10 breast cancers are invasive lobular carcinomas and can be harder to detect by a mammogram. In this slide, we can see an example of what ductal carcinoma in situ, or DCIS, might look like. On the left, you can see where a duct can be found in the breast. On the right, the top image shows of what a normal breast duct looks like with no abnormal cells. With DCIS, abnormal cells grow and surround the normal cells and tissues, causing blockages in the duct. In this picture of invasive ductal carcinoma, you can see a blown-up image of a milk duct. Here, the cells of the lining are growing abnormally and invasive. In invasive lobular carcinoma, the cancer is broken out of the lobule and can potentially spread to the lymphatic system. This image depicts the cancer breaking out of the lobule. So as we talked about earlier, breast cancer forms in the ducts, which are the tubes that carry milk to the nipple, and lobules, glands that make milk. The stroma is the name of the supporting cells and connective tissue of the breast. Stroma cells do not become cancerous. Breast cancer can spread or metastasize in 3 general areas. First, the breast area where the cancer was originally diagnosed. This is called local recurrence. Second, the lymph nodes in the armpit or collarbone area where the cancer was originally diagnosed. This is called regional recurrence. And if the cancer spreads to another part of the body, such as the lungs, bones, or brain, or rarely the opposite breast, this is called metastatic or distant recurrence. Now we'll go over some breast cancer data and facts. Breast cancer is the most commonly diagnosed cancer and the second leading cause of cancer death for American Indian women. 1 in 8 women will get breast cancer in their lifetime. American Indian women have a 7% higher chance rate than non-Hispanic white women to develop breast cancer and a 10% higher death rate than non-Hispanic white women. Approximately 30% of American Indian women in Minnesota present with a late-stage breast cancer. The American Cancer Society has stated that as an individual gets older, the risk of developing breast cancer increases. More than 3 out of 4 breast cancers occur in women ages 50 and older. As I mentioned earlier, more than 99% of breast cancers occur in women, but men are still able to get breast cancer. Here are some facts and data about breast cancer in men. According to Susan G. Komen, breast cancer in men is rare, but it does happen. In the United States, less than 1% of all breast cancer cases occur in men. The breast cancer risk for men is much lower than women. The average age of diagnosis for men is around 72 years of age. The lifetime risk for breast cancer in men is around 1 in 833, compared to about 1 in 8 for women. Most cancers, breast cancers in men, begin in the lobules of the breast and are invasive ductal carcinomas. In 2019, it's estimated that there will be around 3,000 new cases of invasive breast cancer and around 500 breast cancer deaths in men. Some risk factors for breast cancer in men include aging, family history, inherited gene mutations, Klinefelter syndrome, radiation exposure, alcohol use or abuse, liver disease, estrogen treatment, obesity, and testicular conditions. More information about men and breast cancer can be found on the American Cancer Society's website. So now it's time to check your knowledge. Just take a few minutes to think about true or false. The breast has muscle tissue. And you can take a minute to pause the video and decide if this is true or false. And the answer is false. The breast does not have any muscle tissue. Muscles lie underneath the breasts, which separates them from the ribs. And another option to check your knowledge, what are the 3 common types of breast cancer? Again, you can take a minute to discuss this amongst yourself and pause the video if necessary. They are ductal carcinoma in situ, invasive ductal carcinoma, and invasive lobule carcinoma. So now that we have a foundation of breast and breast cancer, we'll move on to part 2 of this segment and discuss prevention, risk factors, and signs and symptoms. So early detection is really key for breast cancer because the cause is unknown. With early detection, there's around a 98% survival rate on average, but around only 80% of women over the age of 40 in Minnesota have regular mammograms. Later on, we'll break that down by race and ethnicity. And so the best tool we really have right now for detecting breast cancer is mammography. And within mammography, we have 2D and 3D mammograms. So there are several actions you can take to help prevent breast cancer from developing. These include eating a balanced diet, maintaining a healthy weight, being active, not smoking, limiting your alcohol use or consumption, breastfeeding, having annual mammograms or mammograms based on your provider's recommendations or your possible risk factors. And although there are many actionable steps you can take to reduce your risk of developing breast cancer, there are many risk factors that still come into play with regards to breast cancer. And you may recognize some of these risk factors in your own communities, which is why it's important to highlight how they'll play a role into high cancer rates. So some of the risk factors for breast cancer include the following. Female. So just by being a female, it increases your risk of developing breast cancer. Tobacco abuse and cigarette smoke exposure have been linked to a higher risk in younger premenopausal women. Alcohol use or abuse, consuming 2 or more alcoholic beverages a day has been linked to an increased risk of breast cancer. Diets high in animal fats and low in fiber, and diets low in fruit and vegetable intake. Lack of regular physical activity and obesity. The World Cancer Research Fund says that about 20% of cancers diagnosed in the US are related to obesity, physical inactivity, excess alcohol consumption, and poor nutrition. Then we have aging. So just like all other cancers, your chances of developing breast cancer increase with age. About 2 of 3 invasive breast cancers are found in women 55 and older. Long-term use of hormone replacement therapy. So postmenopausal women have used this for many years to ease menopause symptoms such as hot flashes and fatigue. And according to breastcancer.org, combination hormone replacement therapy can increase your breast cancer risk by 75%, even when it's used for a short period of time. And it also increases the chances of it being found at a more advanced stage. Family history, so if you've had a first-degree female relative, such as your sister, mother, or daughter, that was diagnosed with breast cancer, that means your chance of developing breast cancer is doubled. So it's important to know your family's history with cancer and not breastfeeding. So producing milk limits the breast cells to become cancerous. So women also have fewer periods when they breastfeed, which lowers estrogen levels. So not only does it lower your risk for breast cancer, but the milk also gives antibodies to your child that can protect them from infections. Late pregnancy or becoming pregnant at a later age. And then family genes also increase risk. Breast cancer can be genetic. About 5 to 10% of breast cancers are passed from their parent with abnormal genes onto the child. And most people that have developed breast cancer didn't inherit an abnormal breast cancer gene, and they typically have no family history of it. But if a person does have an inherited case of breast cancer, most are associated with the breast cancer gene 1 and 2, or BRCA1 and 2. This gene is designed to repair cell damage and keep cells growing normal. But abnormalities or gene mutations can be passed from generation to generation. And these mutations can increase breast, ovarian, and other cancer risk. And you're at an increased risk of having a mutated breast cancer gene if you have blood relatives, such as grandmothers, mothers, sisters, and aunts, on either your mother or father's side of the family who had breast cancer diagnosed before age 50. There's both breast and ovarian cancer on the same side of the family or in a single individual. You have a relative or relatives with triple negative breast cancer. There are other cancers in your family in addition to breast, such as prostate, melanoma, pancreatic, stomach, uterine, thyroid, colon, or sarcoma. If there are women in your family that have had cancer in both breasts, if a man in your family has had breast cancer, or if there's a known abnormal breast cancer gene in your family. And if one family member has an abnormal breast cancer gene, it doesn't mean that all your family members will have it. And it's really important to note that men can inherit the BRCA2 gene from either parent. And a man that has the mutation can pass this mutation to both his sons and his daughters. It's important to note that breast cancer usually has no symptoms when the tumor is small and the most treatable. The symptoms on the left are ones that appear usually later on as the cancer progresses, and are some symptoms to be aware of. These include unusual discharge from the nipple, skin changes, nipple changes, and dimpling or pitting of the breast. And this image shows the size of cancer cells before symptoms are noticed. And this is why screening and knowing your history and self is so crucial. So time to check your knowledge. What % of cancers diagnosed are related to obesity, physical inactivity, excess alcohol consumption, and poor nutrition? So now it's time to move on to the final segment of this session and discuss screening options, screening guidelines, staging, and associated treatment and survival rates. Mammography isn't the only screening option for breast cancer. Breast cancer screening tests include clinical breast exams and mammography, and for some women at higher risk of breast cancer, breast MRIs may also be used. Mammography uses x-rays to create images of the breast. A radiologist reads the mammograms and studies the images for signs of breast cancer. Mammograms are the most effective screening tool to find breast cancer. They can find cancer at an early stage when they're the most small and chances of survival are the highest. Breast MRIs use magnetic fields to create an image of the breast. These are more invasive than mammography because a contrast agent is given through an IV before the procedure. These are mostly used in breast cancer diagnosis and staging for women with higher risk. A clinical breast exam, or CBE, is a physical exam that's done by a doctor or provider. These are usually done during your regular yearly checkups, and they're not typically recommended, but it's important to know your body. Self-breast exams. Although self-breast exams are not recommended, it's important for a woman to know what their own breasts look like and feel like, and if there are any changes to reach out to your healthcare provider. So to review, a mammogram is an x-ray of the breast that is taken by a trained specialist. The breast is placed between two plates that press together to spread the breast tissue. Several images with different angles are then taken of the breast, and the radiologist then examines the images for any abnormalities. According to mammography-saves-lives.org, around 3/4 of women diagnosed with breast cancer have no family history of disease and are not considered high risk, which is why a mammogram is crucial and could save a life. Mammography has helped reduce breast cancer mortality in the United States by nearly 1/3 since the 1990s. For every 1,000 women who have a mammogram, 100 of those get called back for another screening test. 20 of those are recommended for a biopsy, and around only 5 of those are diagnosed with breast cancer. Although these numbers seem promising, we must remember that these are not necessarily reflective of American Indian women, especially women in the Northern Plains and Alaska. It's important to speak to your doctor about all screenings that are available to you, which are a clinical breast exam, mammogram, and even breast MRI for women with higher risk. And this image goes to show the women aged 50 to 74 that report a mammogram in the last 2 years in Minnesota. And as you can see with the green bar, only around 69.4% of American Indian and Alaska Native women in Minnesota report having a mammogram in the last 2 years. So now it's time to think, just to brainstorm. What do you think are some barriers to breast cancer screening? And take a minute to brainstorm some ideas. And here we have some individual and system level barriers to screening. Some of these barriers may also increase the cancer rates in American Indian communities. Here we have inadequate access and availability to service, including poor access to healthcare due to low rates of health insurance, the high costs, socioeconomic issues, high rates of poverty and homelessness, and underfunded urban and tribal health systems. Competing survival priorities, meaning you believe that another health issue is more important than another. Mistrust of the healthcare system, or a lack of accurate data and misinformation. Fear of diagnosis, which could stem from low awareness of cancer risks and screening options, and no money for treatment. Cultural beliefs and practices that may conflict with prevention and screening practices, as well as logistics, such as scheduling, taking time off from work, childcare, and transportation issues. But we also have some solutions to these screening barriers as well, such as private or employer-based insurance, Medicaid and Medicare that covers mammograms for women ages 40 years and older, as well as the SAGE program in Minnesota, which provides free mammograms and Pap tests for eligible women throughout Minnesota. And here we have the screening guidelines for average risk patients. There are different screening guidelines for women who may be at a higher risk of developing breast cancer, but for average risk women, they should have the option to begin annual screening between the ages of 40 and 44, continue annual screening between the ages of 45 and 54, and have the option to either screen every 2 years or yearly after age 55. And it's recommended that screening should continue as long as a woman is in good health and is expected to live at least 10 more years. And these are the screening guidelines for high-risk women. It's recommended that women at high risk should get an MRI if the provider recommends it, and a mammogram every year, typically starting at around age 30, or again when the provider recommends it. And these are just some criteria for being determined at high risk. So if you have a lifetime risk of 20% or more for the development of breast cancer, based on risk assessment models such as the Gale model or the IBIS model. If you have a gene mutation, again, that includes the BRCA1 or BRCA2 gene. If you have a personal history of breast cancer, if you have a first-degree relative, such as a parent, a sibling, or a child, especially with a premenopausal breast cancer, or known genetic mutations, or if you have a history of radiation therapy to your chest before age 30. There are more risk factors for considering yourself high risk, but that's something that an individual should talk to their provider about. And now we'll go on to staging of breast cancer. This is just a simple graphic to kind of show the staging of breast cancer from 0 to 4. Stage 0 being precancerous cells, 1 being localized, 2 and 3 being regional, and 4 having metastasized throughout the body. So in stage 0, there are a couple different conditions that are considered to be stage 0 breast cancer. These are that ductal carcinoma in situ, or DCIS, lobular carcinoma in situ, and Paget disease of the nipple. Again, ductal carcinoma in situ is a precancer of the breast where the cancer cells are still within the duct and they have not invaded deeper into the surrounding fatty breast tissue. Stage 0 can also be classified as lobular carcinoma in situ, and then that Paget disease of the nipple without that underlying tumor mass. And in all cases, the cancer has not spread to the lymph nodes or distant sites. And there are a few common treatment options for stage 0 breast cancer. These include a total mastectomy, which means surgically removing the breast tissue, a lumpectomy, which removes cancer or abnormal tissue from the breast, but not the entire breast, radiation, which is a high-energy X-ray and other particles that are used to kill cancer cells, hormone therapy, which is used for some breast cancers that are ER or PR positive, and according to the American Cancer Society, hormone positive breast cancers are breast cancers that are affected by hormones in the blood and have receptors that attach to estrogen that help them grow. So hormone therapy is a form of systemic therapy, which means it reaches cancer cells almost anywhere in the body. And overall survival rate for stage 0 cancer is right around 100%. Moving on to stage 1, there's 2 categories of stage 1 breast cancer. Stage 1A, the tumor in stage 1A is less than 2 centimeters across, and the cancer has not spread to the lymph nodes or any distant sites. And in stage 1B, the tumor is less than 2 centimeters across, or it can't be found, and there are micrometastases in 1 to 3 axillary lymph nodes that are between 0.2 millimeters and 2 millimeters. And again, the cancer has not spread to distant sites. And these images here depict the situations. The axillary lymph nodes are those in the armpit and show where the tumor may or may not be found. So treatment for stage 1 breast cancer is similar to stage 0 treatment. The options still include that total mastectomy, lumpectomy, and or radiation and the hormonal therapy. But stage 1 may add in a sentinel or axillary lymph node biopsy. And these are surgical procedures that may be used to determine whether the cancer has spread beyond a primary tumor into the lymphatic system, and is used most commonly when evaluating breast cancer and melanomas. So the sentinel nodes are the first few lymph nodes into which a tumor drains. So the biopsy involves injecting a tracer mineral or a tracer material that helps the surgeon locate the sentinel nodes during the biopsy, and then that tissue is removed and analyzed in the lab. Targeted therapy may also be used in stage 1. And according to the American Cancer Society, targeted therapy is a new type of treatment that really aims to target specific cell changes, and it's designed to block the growth and spread of cancer cells. And as the same for stage 0, the survival rate for stage 1 is approximately 100% again. For stage 2, again, there's 2 subcategories. Stage 2A, there's 2 conditions that it could potentially be classified as. So the tumor in condition 1 may be less than 2 centimeters across or not found, and either the cancer has spread to 1 to 3 axillary lymph nodes, and in this case, the cancer is larger than 2 millimeters across. There might be tiny amounts of cancer that are found in the nodes near the breastbone on that sentinel lymph node biopsy. And then going back to stage 2A, the cancer may have also spread to 1 to 3 axillary lymph nodes and internal mammary lymph nodes. And in all cases, the cancer has not spread to distant sites. Stage 2A may also be classified as the tumor being 2 to 5 centimeters. And again, the cancer has not spread to distant sites. So in stage 2A, the tumor might be small and have spread to the axillary lymph nodes, or it just might be a larger tumor. In stage 2B, there's 2 conditions as well. So the tumor may be 2 to 5 centimeters in diameter, and the cancer may have spread to 1 to 3 of those axillary lymph nodes, or tiny amounts of cancer can be found in that internal mammary lymph node on that sentinel lymph node biopsy, and the cancer has not spread to distant sites. Or stage 2B might be classified as the tumor being larger than 5 centimeters across, but has not grown into the chest wall or skin. And again, that cancer has not spread to the lymph nodes or sites. And I really like these pictures because it really depicts that 2 centimeters about the size of a peanut, and as soon as you get to that 5 centimeters in diameter, it's about the size of a lime. Stage 2 treatment, once again, has a similar options to stages 0 and 1. Stage 2 may introduce chemotherapy. The American Cancer Society states that chemotherapy uses anti-cancer drugs, which may be given intravenously or orally to reach cancer cells in most parts of the body. Chemo may be given before, during, or after surgery, and with just one type of drug or a combination of drugs. Again, this all depends on the type and the situation of the breast cancer. Survival for stage 2 breast cancer is around 93%. Again, why it's so important to detect and screen for breast cancer early. In stage 3, there's 3 subcategories. In stage 3A, the tumor is not more than 5 centimeters across or is not found. The cancer has spread to 4 to 9 axillary lymph nodes or has enlarged the internal mammary lymph nodes, and the cancer has not spread to distant sites. Stage 3 may also be classified as the tumor being larger than 5 centimeters across, but has not grown into that chest wall or skin. The cancer has spread to 1 to 9 axillary nodes or to internal mammary nodes. And again, the cancer has not spread to those distant sites. Stage 3B is classified as the tumor has grown into the chest wall or skin, and one of the following conditions applies. The cancer has not spread to the lymph nodes, but the cancer may have spread to 1 to 3 axillary nodes, and or tiny amounts of cancer is found in the internal mammary lymph nodes on the sentinel lymph node biopsy. The cancer may have spread to 4 to 9 axillary nodes or has enlarged internal mammary lymph nodes. The cancer has not yet spread to distant sites. In stage 3C, the tumor is any size or can't be found, and again, one of the following applies. The cancer has spread to 10 or more axillary nodes. The cancer has spread to lymph nodes under or above the collarbone. The cancer involves axillary lymph nodes and has enlarged internal mammary lymph nodes. The cancer has spread to 4 or more axillary nodes, and tiny amounts of cancer is found in the internal mammary lymph nodes on the sentinel lymph node biopsy. In all of these scenarios, the cancer has not spread to distant sites. And it's important to note that as the stages progress from A to C, the conditions become more severe. Stage 3 treatment options may still include a total mastectomy, followed by radiation, or a lumpectomy and radiation, an axillary lymph node removal and radiation, chemotherapy or hormonal therapy, and the approximate survival rate for stage 3 drops to around 72%. In stage 4 breast cancer, the tumor can be any size. The cancer may or may not have spread to nearby lymph nodes, but the cancer at this point has spread to distant organs or lymph nodes that are far from the breast. Some common places of metastasizing includes the brain, lungs, liver, and bones. Stage 4 treatment for breast cancer may include surgery, radiation, or both, chemotherapy, hormonal therapy, or just radiation. And palliative care may be used for stage 4 if no treatment or cure is possible. Survival for stage 4 drops dramatically to around 22%. So, time to check your knowledge. What is ductal carcinoma in situ? You can take a few moments to discuss. Just moving on to more general items. This is AICAF's breast cancer infographic resource. It's a great resource to start a conversation about breast cancer screening and awareness, and is culturally tailored for an American Indian audience. This resource and other resources that cover other cancer topics can be requested from our team and email us at health@aicaf.org. And we also have our Indigenous Pink campaign. Indigenous Pink takes place during October of each year, which is Breast Cancer Awareness Month. AICAF engages clinics and communities all around the U.S. to encourage women to get screened and raise awareness around breast cancer. And on the third Thursday of each month, AICAF hosts Indigenous Pink Day. The goal of this national campaign is to spread awareness and educate all Indigenous people on the importance of early detection and to remind men and women to keep up to date on their breast cancer screenings. The event reaches hundreds of thousands of people each year and continues to grow. So make sure to be on the lookout this October for the next Indigenous Pink Day. Thank you. And if you have any questions, feel free to contact us at health@aicaf.org.